Are you sick of living paycheck to paycheck? Are you sick of having to punch in and punch out and making sure you're getting every freaking hour, every freaking minute, every second so that your paycheck can be a little bit bigger because you work hourly and that's how you make money as a hygienist? Wouldn't it feel amazing if you got paid double, even triple what you're making right now? And you could work less days. This is possible, and I want to show you how. Hi, I'm Trish, and I have been in dental hygiene for 15 years now and have been one of the top producers in my company. And I help driven dental hygienists just like you who are on the verge of burnout. And I help you create ways to make your job easier so that you can have more money, motivation, and energy without burning down your hard-earned degree. So today, I'm going to be telling you about my story working commission as a dental hygienist after working hourly for so long. So when I first got introduced into commission, I was scared, but I knew that there was a possibility of making more money working that way. So the more I studied about it, asked around about it, the more I felt a little more comfortable. The only way I feel like this works, especially if you just start out, is having a base pay first and then working off commission. Meaning that you get like a base pay so that you're walking out with money in your pocket, obviously, because you're still doing work, you're still doing your patient's treatment, and you have to talk to your boss about this. I do have a video that I can link down below on how to work on commission base and the numbers and all that stuff and how to figure out your numbers. But basically you get 33% of what you produce in a day. And I have heard hygienists say, well, if I do production, then I have to have X amount of patients in my schedule. Let me see how many perio patients are in that schedule. Like all these like things they want. So basically, when you work on production commission, the model that works best is you get 33% of your production after it goes through insurance and everything, because it has to be fair, right? You can't be collecting money for yourself that's non-existent. And you get a base pay. So basically, like, let's say no patients show, like you'll still get paid because you have bills to pay, right? And this is something that you need to communicate and write down and put it in a document and present it to your doctor. Be like, this is how I want things to be, yada, yada. If you need any help on that, let me know, because I am your career strategist for dental hygiene. And this model works, okay? It's been proven over and over again that it works and everybody's happy. You make money, the doctor makes money, and the office makes money. There's really no bad thing about it. So the one thing that a lot of hygienists say, which I actually said it myself, was I don't want to work on production because I don't want to like push treatment on my patients, push products on my patients, okay? It's actually completely opposite, okay? Before I did production, I was ignoring so many things, and ignoring things because I felt I was not getting paid for it. I felt like I wasn't being rewarded by anything. Like if I do extra SRP, if I do this, if I do that, like it's just more work for me, okay? And that's the reality, especially when you're burnt out. If you're not getting paid what you are doing, what you're worth, you're gonna burn out real quick. So working on commission production, the more you do, the more of a reward you get, right? The more pay you get. But then you can do it the wrong way, and there's many companies out there that do it the wrong way, which push 1 million arrestants in every freaking pocket left and right. Or you can do it the correct way and just treat your patients for what they need. So let's say that one patient has one tooth that's bleeding, that has a 5 millimeter pocket. Normally I would have watched that. Now I am more proactive, and I say, let's just have you come back. We'll do localized SRP on that tooth. We'll put an arrestin in. The end, right? So you're just doing everything correctly, and almost like, I want to say, it's like this mindset of like, if this was your mom, what would you do for her? If this was your mom, would you let that pocket go? I mean, I wouldn't. I'd be like, no, we got to do something. Let's put some arrestin in there. Let's do a scaling right now. Like, I would do it right on that day and be like, no charge. You know, you would do the best for your mom. You would do the best for your family. So that's the way I look at it. I treat my patients as they are my family, okay? Because they trust you and you're gonna do right by them, okay? The other thing that was awesome after I started working commission and production is I started to enjoy my job more, and I started to back off working as much because I was making more money. Why not work less, right? Still get my same benefits and everything with my employer because we discussed it and I was doing well for the company, so why not, right? Everything is always open to negotiate and discuss, okay? So I started to get really into the oral systemic link, and not just like on this kind of level, like on this kind of level, okay? So I became a certified oral systemic educator and learned just the ins and the outs and everything about that, and my job became even better, even more amazing. This way, I can really educate my patients on the link between the mouth and the rest of our body. And the more you educate your patients on this part, they will listen. This is very interesting to them. They're gonna be like, wow, okay, she really knows what she's talking about. Like, I need to take better care of my oral hygiene, and I need to do this and this and this, because if I don't, then the rest of my body is gonna reflect that, right? Or my diabetes is gonna get worse, or my heart issues are important to me, so I need to make sure I do everything not to have that heart attack again, right? Not to have that stroke again. So if you've ever been thinking about doing this and you're like, oh, my boss is not gonna do that, or he doesn't diagnose perio, yeah, right? This would never work in my office, okay? First, figure out if that's something you wanna do, and then you're gonna present that to your doctor. If your doctor says no, which I highly doubt, I actually did a big survey on one of the Facebook groups that has a bunch of dentists in there, and every one of them said, yes, I would love my hygienist to work on production. Of course, right? So there's no doubt dentists want to work this way. It's much more motivating for them as well, okay? Basically, you can just ask your dentist, like, hey, I want to work like this. Do you think we could try it? Try it, okay? You don't even have to like one and done, like we're doing it, it's like this for the rest of my life. Like, why don't you have a trial run? Try for like a month. Try for a week, but really you need like at least a month to try it out, and then see like how you would do, okay? And then you can kind of work from there to see where your numbers are at, if you need to improve on your numbers, if you need to work on treatment planning and treatment recommendations for your patients, yada yada. So first step is to ask, and first step is also to figure out if that's how you want to work or not. You can also use your production numbers to leverage yourself a raise or benefits too. So final thoughts on this is I feel like every hygienist needs to work this way. I would have never ever said this a long time ago, but now I am, because I've had the experience and I went through it and I know what it feels like on the other side. I just don't think hourly cuts it. We have this imaginary ladder that we can't climb up as a hygienist. I think that working production is the way to climb up. The way that you can do better for your patients. But I do understand that it can be very scary for something that you don't know how to do. If you ever need help, let me know. I can help you. I do also have a video I will link down below on how to work commission and all that fun stuff, learning kind of the business side of dental hygiene. And if any of this resonated with you, I'm going to leave down below a playbook on how I got out of hygiene burnout. It's awesome. You'll also get like a risk assessment score and let you know where you're at. And from there, I'll give you some free resources like a free journal and all this other fun stuff, de-stressing stuff. And I'll leave you on one more note, and that it is that your intuition holds the key to unlocking a life full of joy and success. Until next time.